All right, welcome everyone to Sexual Assault Services of Saskatchewan's Sexual Violence Prevention Month webinar, The Case for Primary Prevention, Going Upstream to Prevent Sexual Violence in Saskatchewan. My name is Telmar Slay, and I'm the Communications and Community Engagement Specialist for Sexual Assault Services of Saskatchewan. Joining me today for moderation is Patience Umera Waneza, our Director of Policy and Stakeholder Relations. Before we begin today, I'd like to open with a land acknowledgement. Sexual Assault Services of Saskatchewan acknowledges and honors the enduring presence of the people who have cared for this land since time immemorial. The Nehiyawak, the Nakawiniwak, the Dakota, Lakota, Nakota, Denosiline, and the Métis Michif Nation. We reaffirm our commitment to serving all Saskatchewan Treaty territories, including Treaties 2, 4, 5, 6, 8, and 10. We recognize that the spirit and intent of the treaties has not been fully honored, and that our communities suffer from the legacy of colonization, including dispossession, discrimination, and systemic violence. Thus, as treaty people, we are committed to decolonizing our work, our practice, and our relationships as we confront the injustices that continue to impact people's lives today. We are dedicated to moving beyond acknowledgement by building relationships and working in partnership with Indigenous peoples in the spirit of truth, reconciliation, humility, respect, and reciprocity. I also want to mention that today's topic may bring up some difficult memories, emotions, and thoughts, and I encourage you to take the space you need to take care of yourself. Please take breaks as you need them, and if you're looking for support, we'll throw into the chat some links for support resources around the province and in Canada. For those of you unfamiliar with us, Sexual Assault Services of Saskatchewan is a provincial nonprofit organization that works collectively with frontline agencies, community partners, and governments that provide support and advocacy for those affected by sexual violence in Saskatchewan. We support our 13-member agencies and our partners across the province through research, education, policy development, and advocacy. 2025 marks the second year that Saskatchewan is observing Sexual Violence Prevention Month. The transition from awareness-based approach to a prevention-based approach reflects a broader international shift towards addressing the root causes of sexual violence. This means focusing on the cultural and structural conditions that allow such gender-based violence to occur in the first place. Sexual Assault Services of Saskatchewan has partnered with SHIFT, the project to end domestic violence at the University of Calgary. Together, we are working to build Saskatchewan's capacity to lead in primary prevention, equipping a diverse team of policy and practice stakeholders with the tools and skills they need to test and implement innovative strategies aimed at ending sexual violence. SHIFT is Canada's first research hub dedicated exclusively to preventing domestic and sexual violence before it happens. Today's speaker, Lana Wells, is the visionary behind this groundbreaking research hub. Lana is a top-ranked and globally respected scholar in the field of social work, public policy, and violence prevention. She is an associate professor at the Faculty of Social Work at the University of Calgary. She has worked with hundreds of community-based organizations and all orders of government to transform our systems of oppression and reimagine possibilities through an equity and human rights lens. Today, Lana will highlight the importance of primary prevention and introduce a new Sexual Assault Services of Saskatchewan resource developed with SHIFT that deepens our understanding of primary prevention in Saskatchewan and offers practical tools for applying its principles in practice. Without further ado, welcome Lana and take it away.
Thank you. Hi, everybody. I wonder as people are coming in, if you want to flip on your screen and give a wave. I'd love to see who's here today quickly. And I wonder in the chat box, hi, Dolores. Hi, everybody. Carolina, Harvey. Oh, Harvey Gibson, Stacy, Carolyn. So good to see Jody. Hi. And thank you you don't have to keep your screens on. Hi, Denise. Oh, wow. So exciting. Okay. Well, thanks for I just wanted to, it's always good to see Amanda. Oh, hello. Oh, wow. Okay. Hello, Saskatchewan and fellow social workers and change makers and really trying to get at root causes to stop violence before it starts. Thank you. Thanks. You don't have to keep your screens on. I just wanted to see real people for a moment. Head back off. I'm super excited to be here, and I've been working with Carrie, Patience, and SASS for the last few years, and I just want to honor Carrie and Patience, and of course Tal. Thank you. It's been extraordinary to work with the provincial associations that care so deeply, and it's been really great trying to take some of our learnings in Alberta, transfer, but also learn the uniqueness in Saskatchewan. And so today, really, I'm going to take you through some highlights about primary prevention. And we're launching a module today. So congrats to SASS. We have a Saskatchewan-based, very specific modules around the social conditions in Saskatchewan and to try to increase practitioners, social workers, policymakers, funders, anyone who's trying to dig into changing really the root cause of violence and particularly sexual violence, which I'm going to get into today. So thank you for coming. I'm super excited to be here. I'm going to launch in. I'm going to share my screen for a bit, but nope, that's not working. Hold on a sec. Let me just find my PowerPoint. I wonder if in the chat box you would be okay with telling me oh, I've lost my PowerPoint. Give me a second. What is your area of interest and why you came today? And then I think Patience is going to moderate today.
Yes, I'll be moderating.
Awesome. So I'm just gonna.
Okay. Lana wanted to know what is sort of the background for folks who are joining in today. Are we practitioners? Are we part of government, funders? So just wanting to kind of get an idea of folks' background and interest for today. Thank you.
Great.
High school social worker. Nice.
Awesome. Nope, this isn't going to work. Hold on a sec. Keep going, Patience. Keep talking because I'll grab my thing.
Medical social worker. Awesome, awesome. NPO. Okay. Community educator in Yorkton. Welcome. Medical student. Awesome. Oh, oh, very interesting. Dispute resolution office.
Oh,
Yes,
great.
IPV is a significant factor. Always looking for resources and knowledge. Awesome. I hope we have some stuff that can be really useful for you here. Sagaces. Awesome, awesome. Real Talk coordinator, crisis and outreach. Perfect. Thank you. I'm so glad you've chosen to spend your lunch hour with us then.
Awesome. Now,
I think your notes are showing, Lana.
pardon? All the
Your
notes?
notes. Yeah.
Okay, let me see here. Let's see here. So I'll stop that. Sorry, gang. We're just
Marilyn
having
said she's concerned about the effects of porn on our up and coming generations. Absolutely. Absolutely.
absolutely. And the online manosphere as well.
Yeah.
Yeah. I'm just gonna.
Lana's doing a lot of really interesting kind of studies on the side about the manosphere world and all of those pieces. So follow whatever she's doing online. It's all it's very interesting. Registered nurse in acute psychiatry. Yep, thank you. I can only imagine what you're seeing in your day-to-day work.
I think we may have gotten there. How are we doing?
It's perfect. You're ready to go.
Okay, thanks for everyone's patience and patience. Um, yeah, lots of stuff going on, and I'll talk a little bit about. So you'll see on the screen, we do have a website, preventdomesticviolence.ca. I encourage you to go there. There's over 100 reports for over 15 years trying to get underneath primary prevention. And then today, I became a co-founder of Shift to Learn, where we're building an online learning platform to actually advance a prevention workforce. And that's part of today of why we're launching a module with SASS and specific to the social conditions in Saskatchewan. So I'm super jazzed to be here. I do also want to express more than a land acknowledgement. I want to recognize Indigenous peoples as the original stewards of the lands and want to continually reflect and learn on the ongoing impacts of colonization. I am personally committed to ending violence against Indigenous women, girls, and two-spirited people and trying to advance reconciliation through action. And for those interested, I have up on the screen, you can learn more about our work in this area. We have a strong women's circle that we've been supporting for 5 years. It's an initiative that's focused on supporting actually economic and service sovereignty through systems and policy change with elders, knowledge keepers, and grandmothers. And we're about to have our third film come. The elders had said to us, work with Indigenous youth. And we've now been putting a film together about Indigenous and with Indigenous youth, understanding and learning about policy and legislation and how to influence and change that. So I want to express my heartfelt gratitude and respect to Indigenous leaders who continue to advocate tirelessly for an end to violence. So, as mentioned, at the university, have a research hub. We work in the academic world, work with community and practitioners, work with government policy. We are always trying to figure out where the sweet spot is for change. And so we'll work with anyone who wants to get at root causes and stop perpetration of violence. We also, I want to acknowledge a Shift to Learn, which is the online learning platform I mentioned, and we'll talk more about it when we get to the end. But today we're here to really celebrate a partnership with SASS, which is launching a new online primary prevention module. And so we're going to talk about that at the end, give you the QR code. Hopefully you'll take it. Hopefully, really, this webinar was to just get a taste and get some excitement around prevention. So we're going to try to do 5 things today. One is let's get into what primary prevention is and why it matters now more than ever, especially when it comes to sexual violence. I want to talk about why preventing perpetration must be as central to our work is as supporting survivors. It's and both. The case for engaging men and boys to stop violence. We do have a module on this. I'm going to touch on this, but really working with men and boys is a key primary prevention strategy. Fourth, what does it take to move funders and decision makers towards meaningful investment in primary prevention or prevention work? Because I know it's hard to get prevention dollars. So we're going to talk a little bit about that at the end. And then, of course, we're going to launch the new module called Eliminating Sexual Violence, the Essential Role of Primary Prevention in Saskatchewan. All right. So let's unpack the problem we're trying to solve. So in Canada, we know that most violence is committed by men, right? We know that 99% of sexual assaults are committed by men. They also commit 93% of sexual assaults against other men. They perpetrate 83% of violence against women. And they are 3 times more likely than women to offend criminally. So that's including violent crime. We also know at the same time, compared to women, men experience higher rates of suicide, more injuries and earlier death, higher rates of serious illness and health problems, and more alcohol and substance abuse issues. And these issues are even more severe for racialized and Indigenous men who are often overrepresented in many of the systems that cause harm, like prisons, child welfare, the healthcare system. And this is because patriarchy doesn't just hurt women. It also hurts men, especially when combined with racism, colonization, and other forms of discrimination. So to build healthier communities, we must work to change the systems for everyone. I also want to provide more context because when you think about Saskatchewan and now learning and traveling a little bit there over the last few years, approximately 2/3 of your population resides in urban areas, and about 1/3 resides in rural. And you have about a 17% population of Indigenous peoples, including 11% First Nations and 5.7% Métis. So this has an impact on gender-based violence. So for example, we know the rates of domestic violence and domestic homicide in Canada are 3 times higher in rural areas than in urban areas. We also know the rate of police-reported sexual assault in rural areas was approximately 1.5 times higher than in urban areas. We also know in remote areas, the rate of police-reported sexual assault and sexual violence and violations against girls under age 15 was over 3 times higher than in metropolitan areas or accessible areas. We know rural perpetrators use more chronic and severe violence against their victims, and rural victims experience more negative outcomes on their well-beings for a variety of issues, which many of you who work in this area would know. And then we also know that violence doesn't affect everyone equally. In Saskatchewan, 88% of sexual assault victims are women, and the impacts are felt most deeply by Indigenous women, girls, 2S LGBTQIA plus people. And while survivors and those who use violence come from all walks of life, the harms of sexual violence are not evenly shared. Indigenous communities face higher rates of violence due to the lasting effects of colonization, systemic racism, and social exclusion. And this reality highlights the urgent need for primary prevention strategies that go beyond individual programs. We need approaches that directly tackle gender inequality, colonization, and the social conditions that allow or perpetrate or reinforce violence. And the other piece I know many of you know in this field, we do not know the true scale of sexual violence because incidents are severely underreported. And for example, it's estimated that in 2018, only 6% of survivors reported a sexual assault to the police. So we really don't have the breadth of knowledge on the rates, although we have pieces from different places. And, when I was designing this presentation for today, I came across this visual, which I remember and I've used many times, but it's a 2012 visual. A shout out to YWCA Canada and Holly Johnson, who designed this, and such important work because really it still paints a grim picture, right? And it's a very powerful picture. It highlights just how little accountability exists when it comes to sexual violence. And when you think about the low reporting rates and the high level of attrition within the justice system, which you're seeing on the screen, it becomes clear that the true scope of sexual assault in Canada is far greater than what's reflected in official statistics, right? And so I want to give you a moment to read this. I want to shout out to the YW again for pulling this together because when you see this, it starts to, well, I don't know about you, but when I reread this again, and I'm going to dig into even a bit more data, that how important this issue is. And we are not giving it what we need. And so to underscore this point even further, while most crime in Canada has been declining or stabilizing, one category continues to rise: sexual violence. And so what's interesting is over the past decade, police reported rates of many crimes have decreased, but sexual violence continues to stand out as one of the few crimes that has consistently increased. And in fact, according to Stats Canada, the rate of police reported sexual assaults in 2022 was the highest since national data collection began in 1996. And then it rose again in 2023. So it's a troubling trend. And this is despite major public awareness efforts or policy reforms or global movements like Me Too. And while improved reporting and shifting societal attitudes might explain the rise of reports, many experts agree it also signals a deeper, more persistent problem. Sexual violence remains widespread and under-addressed, particularly against women and girls, Indigenous women and girls, and LGBTQ+. So, if sexual violence is the only crime on the rise in Canada, it tells us one thing clearly: response alone is not enough. We cannot rely solely on after-the-fact interventions. We must invest in primary prevention strategies that address the root causes of violence. And that's why primary prevention is not just important, it's urgent. It is time to shift and remove the burden of safety away from victims and focus some of our time and attention on the people and systems that are causing harm, because we know the cost of raising perpetrators is hurting everybody. It impacts all of us, whether socially, economically, and emotionally. So it's really time to enhance our approach that prioritizes prevention, accountability, and systemic change. So I'm going to explain. We have a belief at Shift that perpetrators are made, not born, and this informs all our work. So we believe people who perpetrate violence are made, not born. People who use violence aren't born that way. They learn it. They learn it through what they see, what they hear, and what they experience, and are socialized in their everyday lives. And we know violence can take root in so many places: in our own families, in our schools, in our friend and peer groups, in our neighborhoods, in our sports teams, in our workplaces, and our places of worship. We also see it through the media and even in the way our systems and institutions are set up. So sometimes harmful behaviors are passed down, ignored, or even rewarded. And larger forces like racism, sexism, colonialization, and inequality can make it worse. So again, that's why preventing violence means more than stopping individual incidents and dealing with the post-harm. It means looking at the bigger picture and working together to create communities and social norms where respect, nonviolence, safety is the key. So if we want to stop creating perpetrators, we must change the conditions and settings that produce them. And that is what primary prevention is. It's trying to change the culture and structural conditions that enable and drive, reinforce perpetration of violence. So hopefully you're all like, yes, that's right. So we believe to prevent violence then, which is another belief of ours, it is preventable. We focus on the conditions that allows it to happen. So what does that mean? Well, we have to be challenging and changing harmful beliefs and gender norms and systems of sorrow. We have to transform our laws and our policies and institutions because those guide our behaviors. They tell us what we can and cannot do as citizens. And we need to create cultures that are rooted in respect, equity and equality, and nonviolence. And we need to base those cultures in all the places that we live, we learn, we love, we work, we play, and we worship. So, unlike secondary or tertiary intervention or prevention, which I'm going to get to in a moment, this is really, those approaches are important. They respond after violence or harm has occurred. Primary prevention is proactive. It works upstream. It tries to identify root causes, risk factors, which we're going to get into, but ultimately it's trying to create a safer, more equitable community where violence is less likely to occur. All right, so why does primary prevention matters? I think we can all sum it up because it actually stops harms before it starts or stops violence before it starts. So if we prevent more people from not perpetrating, right, we'll lessen the load of our work. Second, it's we have to start to acknowledge that most gender-based violence is committed by men. And we need to work with them. We need to identify earlier risk factors like trauma, exposure to violence, and isolation. But really, if we want to end this form of violence in particular, we need to work with men and the systems that enable harm. Third, it breaks the cycle of violence. Many people who use violence have experienced it themselves, and prevention teaches healthy relationships, emotional skills, nonviolent ways to cope, but it is also changing the community conditions and norms to support those behaviors. It's also cost-effective and sustainable. Stopping violence early reduces pressure on healthcare, the legal system, housing, social services. It really is a smart long-term investment in community well-being. And lastly, really, it builds safer, more equitable communities, which is creating lasting change, which we all want to see. So by addressing root causes like gender inequality and harmful social norms, prevention helps create communities where everyone can feel safe, respected, and able to thrive. All right, I'm going to turn to patients for a moment. Is there any questions from the group? Because I can't see the chat box in presentation mode.
No questions.
Okay, so that means we can keep going. Awesome. Okay, so why primary prevention? Primary prevention efforts are focused on reducing the overall prevalence of violence rather just than responding to incidents after they happen. And so here's an analogy we like to use at Shift to help explain. And once you hear this analogy, it just makes good sense.
At Shift, we like to use the image of a river to explain primary prevention. So picture yourself. You're standing by a large river with a high waterfall. At the bottom of the waterfall, you can see people drowning, and you can see many people frantically trying to save them. One individual looks up and sees a never-ending stream of people falling down the waterfall, so they start to run upstream. One of the other rescuers hollers, "Where are you going? There's so many people that need our help out here." To which the individual replies, "I'm going upstream to find out why so many people are falling into the water." Gloria Steinem stated that this idea of going upstream is really our 21st century task, and that is what primary prevention is all about. In essence, we need to get better at going upstream to understand and address the root causes of violence. We need to focus our energy and attention on primary prevention to stop the violence before it starts.
So hopefully everyone's going, yeah, that makes total sense. So primary prevention is a proactive approach to stopping violence or harm before it occurs by addressing the underlying causes, risk factors, and social conditions that lead to it. So what are underlying causes? Those are deep rooted factors that drive harmful outcomes like poverty, gender inequality, and intergenerational trauma. A risk factor is anything that increases the likelihood of harm or adverse outcomes. And social conditions are a community or societal factor that shape people's opportunities, well-being, and experience, and changes the norms and expectations of behaviors. All right. So primary prevention can work at the community and societal level to create long-term cultural change rather than focus solely on individual responses to violence after it has occurred. It has to be an and both. So one way to understand this, and as you're thinking and looking up at the screen, we use a prevention continuum triangle, and I have an activity for you. And this prevention continuum is basically a framework that categorizes intervention into 4 levels, right? If you think about our anti-violence movement, historically, it's predominantly focused on crisis intervention, which you'll see at the 3rd level, right? So this is responding after violence has occurred. This includes programs like women's shelters, sexual assault centers, or mandated programs for men charged with domestic violence. And it's represented, as I mentioned, in the crisis intervention section. Now, this work is essential. Thinking about that, we also need to shift some of our focus toward early intervention and ultimately primary prevention at the community and societal level. So this approach tackles violence at its source by addressing the underlying societal culture and behavior factors that perpetrate violence. So if you think about crisis intervention, where most of our services have been, we've started to move up early intervention. Let's say child maltreatment, we're trying to prevent, or nurse family partnership is an early intervention. And then primary prevention is actually trying to get at the root causes so the violence and the at-risk behaviors don't even begin. And then, of course, at the top is the rebuilding lives. And that's where providing people employment, literacy, housing, all those issues that it takes to actually rebuild people's lives, reduce trauma, and support healthy relationships. All of these matter, and they're not super distinct. There's a lot of overlap, but when you think about your prevention activities, thinking about all these layers, I think is important to be doing the work that we're trying to do. All right, so I have an activity now. Can you take a moment to reflect on your own work? So here's the prevention continuum written up from primary, secondary, tertiary. I would love to see hands on the screen. Who works in the crisis intervention tertiary area? So those are efforts focused on those are efforts focused on long-term support and intervention for those affected by violence to prevent recurrence. Can I see hands? Any hands in the room doing that crisis intervention? Okay. How about early? Thanks, Jody. That's great. How about early intervention? Any hands? So that's early interventions targeting individuals or group at higher risk to prevent the onset of violence. Anyone doing early intervention? Great. How about rebuilding lives? Anyone working post? Working after the resettling, integration? And then what about primary prevention? Great. Dolores, Peggy, awesome. Awesome. Great, Carolina. Awesome. And so when you think about when you're looking at your organizations or your programs, you can start to map a little bit about where are we focused, and how do we start to shift? Because our role at Shift is we are shifting shift. We are trying to support organizations like SASS and other, I'm working with 3 gender-based violence women's shelters around shifting to do and both. And how do we do that well? And I think as our prevention strategies get stronger, we get more evidence, we're able to share with each other. I think that's where we're going to see a change. Awesome. Before I head into the case for engaging men and boys, is there any questions or comments, or does anyone want to jump on? Thanks, Carolyn. No questions, but hey, we are recording this, by the way, so we definitely can send it out. And okay, no questions. Everyone's good? Okay. let's move to the case for men and boys. I suspect, all right. Is this good? Patience? Can you see it? Anyone?
Yep, it's perfect.
Perfect. Okay. So now that we've explored what primary prevention is and why it matters more than ever, especially with sexual violence rates going up, now we need to talk about why it's key to engage and mobilize men and boys. Because honestly, if we truly want to stop violence before it starts, our strategies must include men and boys from allyship all the way to those who perpetrate, because they must be part of the solution. And so let's take a little bit of time to talk about their involvement, why it's critical. And so when we think about engaging and mobilizing men as allies, as leaders, as partners, collaborators, and as co-beneficiaries, that means there's a win-win in it for them to achieve gender equality and prevent sexual violence. This is a key primary prevention strategy. And for 15 years, we've been trying to better understand how to engage and mobilize men, how to build it into policy frameworks, how to work with organizations to offer programming, whether it's for fatherhood, how to do engagement strategies across the organization. It is a critical area that we've been building and learning for 15 years. We now have an evidence-based approach to working in male-dominated workplaces. And so this is critical. So as you're thinking about your initiatives and agencies, thinking about building capacities in order to do that is so important. And I'm going to suggest there's 5 compelling reasons to engage men and boys. As we mentioned and talked about at the beginning of this webinar, we know that most gender-based violence is perpetrated by men. We also know men and boys are deeply affected by gender norms, which ends up influencing their behaviors. So when you think about rigid expectations around masculinity, this can fuel violence and harm men's mental health, and which means harming sometimes then in their relationships. And so prevention efforts offer healthier, more authentic alternatives to norms and behaviors. We also know men have influence, of course, everywhere in our families, in our workplaces, all throughout our communities. And so when you think about fathers, coaches, co-workers, and the leaders, they play a key role in shaping attitudes and behaviors and gender and community norms. And we know when men speak out and model respect and equity and nonviolence in leadership, it sets new norms for what's acceptable for other men. Violence prevention is everyone's responsibility. Ending sexual violence requires a collective action, and engaging men affirms that this is not a woman's issue, it's a human issue that needs all of us. And then lastly, when men are part of the solution, change is more sustainable. Programs and initiatives that include men and boys create broader cultural shifts. Their participation not only prevents violence, but also strengthens communities built on equity, respect, and accountability. Okay, question to you in the chat box. Are there other compelling reasons to engage men? Anyone? Do you have a compelling reason? Did I hit the top 5? Is there something you would add? I bet you didn't know you were coming to a webinar where we need you to participate. There often are premieres. I'm not sure what that means. You mean there often are? Oh, yes, political, of course. Yes, they are our leadership. They are in our political space. They are controlling the narrative, and definitely the community and social norms and societal. No, don't worry about that. I was just, that's great. Yeah, they are in leadership positions. Think about the Fortune 500 companies. Think about the workplaces in Saskatchewan. Who are leading those workplaces? Who are leading the decision making on consent education in your schools? Who are making these decisions? Anyone else? Any other compelling reasons you can think? All right. Okay. Awesome. Okay. So if we want to end gender-based violence, we cannot do it without men. We have to do it with men and boys. And true prevention means everyone is at this table especially those with power to create change. Awesome. Okay, we're going to move. We have 2 more sections today, and then we're going to open it up to questions. So I want to close today's webinars by highlighting the critical role that funders, policymakers, ministers, bureaucrats, family foundations, and philanthropic leaders play in advancing prevention. Because we know real change is only possible when those with influence and resources choose to invest in long-term solutions, not just short-term responses. So let's turn to the heart of it. What does it take to move funders and decision makers toward meaningful investment in primary prevention, including engaging men and boys? Well, I have 8 reasons up there. And this has been something we've learned over the last 15 years, but to build real momentum around primary prevention, especially including men and boys, we need to speak the language of influence, strategy, evidence, impact, and a return on investment. So we need to be able to make the economic case, which we did in 2012. We built a case in Alberta of the cost of violence against women and how critical it was that we go upstream, and that prevention actually saves money. So you want to think about that in Saskatchewan, because we know preventing even a small number of incidents leads to massive savings in healthcare, policing, legal services, and lost productivity. We want to reframe the narrative. This is not a women's issue. It's not a wage, women and gender equality issue. This is a public safety and a cross-ministerial issue. And so we need to be thinking about it's not nice to have. It's like clean water or fire safety. These services should be essential services. They should be in legislation, and this should be a public safety issue. It's a crisis. It's a public crisis. We need to be able to provide some evidence of what works. So that means collecting good data, demonstrating proven outcomes, and tracking and evaluating and refining that over time so that we have good data to give to policymakers. I also think what it takes is reframing the narrative, and that's shifting mindsets from reaction to prevention. And that is tough because I think a lot of people think they're doing primary prevention, but they're probably doing secondary or early intervention. And all of it is important, but moving upstream means looking at root causes, looking at systems and policy that are actually creating and enhancing and enabling violence. And so trying to shift policymakers, government workers, because they like to fund programs. We call it the programs for problems model, where it's just, this is a complex issue. It's not going to take one program. It's going to take a community-wide systems approach to get at this wicked problem. And we need everybody in the tent. And so trying to get people to think about not just today in the crisis today, but what we could do more upstream is critical to reframing the work that has to get done. I would say also showing the community demand, readiness, and momentum. So building organizational capacity to do this work, getting people trained so they could work with all genders and all peoples, learning how to work with policymakers and informing legislation as well. Those are critical, critical skills. I also think this is about long-term and cross-sector benefits. We're recently now working with different organizations, the private sector. I know SASS does a lot of work in that area and trying to get the private sector to believe they're part of the problem, but they're also part of the solution. We need more people in the tent. It's not up to the gender-based violence sector to solve this problem. I mean, they have to be influencing and supporting it, but others play a significant role, and we need to widen the tent to invite others in. And then, of course, we need to get good at offering a clear investment roadmap and demonstrating good, I think, programs, initiatives, collaborations, policy work is critical, and demonstrating that roadmap and I know Carrie and Patience with the 13 members, are doing that where they're trying to submit changes to policy. They're trying to influence and provide roadmaps for prevention for the Saskatchewan government. And the political will is critical, right? I think it's educating and supporting ministers and key bureaucrats, deputy ministers, assistant deputy ministers. Local level is critical, policymakers to getting the political will to shift some resources upstream. All right. So we have a few discussion questions for you. This is to get us start, and then we'll launch the module after you all have a few minutes to chat. But what do you think are the barriers and challenges for you to engage in primary prevention? Where do you think there are opportunities to engage in primary prevention? If you're a funder in the room, what's getting in your way to invest upstream in primary prevention? So before we launch the module, I'm going to just open it up to questions and comments and reactions.
Hey, so as folks are thinking about answers to the question that Lana asked, one of the things that I could share, if I may, that I think I've encountered doing this work for a long time is that prevention takes time to show up, like in terms of the impact. And I feel like it's hard to convince funders sometimes that, if you invest in this right now, that in 10 years it has this kind of benefit when political cycles run in 4 years, when funding cycles or 2-year programs are very short-term based. And I think that kind of puts a lot of our programs in a bind. Often you have to fund something new, right? It can't be a continuation of what already exists. So I don't know about anyone else, but I know for me that has been, I think, a challenge in terms of like when you talk about investing in primary prevention. Yeah, it's harder to quantify. I think, Jody, yes, you said that well.
Go ahead. No, is it Nofa?
Yeah.
Yeah,
Hi.
go ahead.
I'm just curious in terms of, I guess this is a question kind of related to those questions, but not. Um, where does community play a role, or how do, like, um, is the learning to work or for organizations to work in our formal systems? Like, I recognize the system play a huge role, but I'm wondering around those cultural norms that you were speaking about earlier, and where does community play a role, or how do we work with communities? What's your experience been, especially in smaller, rural and northern in our province?
Thanks, Nofa. That's a great question. I'll let Patience, because I know also SASS has gone around and really done major consultations around that. But I'll jump in. The last few years, we've been working with small towns in some rural areas to support GBV organizations or gender-based violence, women's shelter organizations to start to play a different role in community. So not just offer the programs per se for shelters, even programs for men, but to actually shift and change the social conditions in the community. So what we've done is we've gathered community data and understanding the social conditions per that region and area. So very specific data. And then we've presented it through data walks in the community and gotten their lived experience of and consolidated what they think and feel, and then put together a series of recommendations. And for an example, we're working with Banff. We now, in Banff, the tourism industry is 61% of the employers. They are now coming into the project. They're saying, we have a problem. We're contributing to the problem. We're going to be part of the solution. And right before I came on this webinar, I was meeting with a major employer who is going to do some culture change work within their organization around recognizing and responding, but also supporting disclosures, but also shifting the workplace to better support employees so that violence doesn't show up in the workplace. That's one example. And then I have 12 employers in Banff that are willing to now be part of a strategy that they're building within their own workplaces. And I think historically, the gender-based violence movement has responded by creating programs to the problems, as opposed to looking at what are the conditions that are creating. And and I think it's a very shift and it's a different way of working. It's a community development approach, of course, but it's the other piece on that is we're working with the RCMP at that local level, who has just shared data, because we also really don't understand the extent of the problem. And often we don't get all the reports from policing. And we are trying to understand who is perpetrating, what are the patterns of perpetration, who are they, so we can figure out earlier intervention points. So I'd also say in community, you actually have to also surface the problem you're trying to address, which means getting in conversation with community so that they surface that this is an important issue. This is how it's showing up. And I'm happy to take offline on how our approach to do that. But it is community developed, doing with, not for, and supporting community to change the community conditions, which I know is different than just responding or helping, right? It's a different set of skills.
Thank you for that, Nofa. That was a good question. One of the things that why we even wanted Lana to help us is because even as a provincial organization that represents these frontline agencies, we recognize that we were really focused a lot on the intervention. Even what we would call prevention work were really bystander intervention materials. And often Lana's like, that's not prevention, that's not primary prevention. And I think another thing that really struck me, and I don't know, maybe Lana could expand on this, was Lana said this to us early on. She said that by the time somebody gets to us at at our centers, at our shelters, it's already too late, right? Like that, it's right, it has already happened. So when you think about it and you go all the way back, I think the role that our community gives us, what we've been leveraging has been, first of all, information to understand what are the conditions, right? Like Lana said, what is happening in your community and what is needed to strengthen your community. I think COVID, for example, was a great kind of point in time to show us that depending on how well situated your community was, like the impacts to that community was a lot worse if you didn't have all these other structural conditions in place, right, to support a community to respond to a crisis like that. And I think that has been a way for us to talk to a lot of our communities to say, this is a crisis, and what do you need so that you are better prepared to prevent it, but also if it does occur, that you're also better prepared to respond to it. And so, one of the communities we went to a few years ago, we asked them, what would you need to prevent sexual violence? And they said, we need the elk. And I thought, what does that even mean? And they said that to them, elk is access to culture. Elk is food security. Elk also helps some of the kind of financial resources. Elk was also a way for men to have things to do together, right? Like that in itself was violence prevention for them, right? And I don't think we always see it that way. And I think when we go back to funders, we say to them, if you invest in these things, this is the long-term implication there. So that's, I think, one of the things we're asking communities to really sort of shift their mindset, like just beyond what do you need right now to respond to a crisis, but what would you need to raise healthier families? What do you need in your sports clubs, in your places of worship, all of those pieces. And then we are able to then take that back to policymakers and say, this is what's necessary. And the other piece too is to say to, especially for any of us who represent frontline agencies, is we're not saying that it's an either or, that when we're pushing for primary prevention, that we're not also pushing for your crisis work, because that matters too. But we will never be able to respond enough to everything. Like it's just the flow of trauma is way more than we can ever respond to. And we have to get our policymakers to shift their perspective. So I don't know if that quite answered your question, but I think that's, one of the ways that we're learning to how to sort of bring in our community. And this is also why we're having this conversation, is to collectively learn together as well. Any other question?
I would also say, it leads into actually quite well the module. So Nofa, thank you for asking that question, because why we built this module goes beyond a 101 of understanding. It actually starts to break down the community conditions in Saskatchewan as a whole. And then what we'd hope, it would give the skills at the local level that you could be looking for those regional social conditions. And so I want to congratulate SASS. We're super jazzed. All of you are at the launch. And so thanks for coming. It's an online module called Eliminating Sexual Violence, the Central Role of Primary Prevention in Saskatchewan. And I'm going to turn it over to Patience to take us through it.
Okay, awesome. Thank you. Thank you so much, Lana. Again, like I said, one of the first things that we did when we brought Lana on to help us, because we realized that this is an area that we didn't have that expertise. And there's really Not a whole lot of that in Saskatchewan. And so we were so grateful for the Shift project, a first of kind Canadian research hub that specialized in this issue to come and say to us, okay, what do we need? And, one of the first things we did is really kind of do that work of understanding what are the conditions that's happening, because we need to have that shared understanding of the issue, shared understanding of what primary prevention looks like, so that we can collectively move forward in the same direction. And once we did that, Lana and her team at Shift to Learn helped us develop a module that is going to be open to everybody to access for free. It's about 30 minutes. 30 minutes long. So if you scan onto this QR code, it will take you to our website. Lana, do you mind if I just show people how to get on there? Could I?
Of course, do you want me to stop sharing?
Sure.
You bet.
Okay.
You're
Okay.
good?
So, all right. So it will take you to this page. When you click on that QR code, primary prevention is the module. So you click enroll. And once you get there, you'll have a sign up page. And it's really just to get cursory information, and then it will get you right in to our site. And this is what it looks like. It's a little tab over here that you click on, and that will lead you. Oh my goodness, this thing is in the way. That will lead you to this course this is how it looks like on the inside. I've completed the course, so, but I'll show you kind of what it looks like on the inside, and it's self-guided. You can stop and start however you need.
Please click the link on the screen to app.
And you will meet our lovely facilitator, Lana, who will be guiding you through this wonderful conversation. So please join in. We'd love to hear what your thoughts are on this module. There's a evaluation at the end just that allows us to continue to improve on this. And our commitment is that we will continue to develop more resources that allow our Saskatchewan practitioners, policymakers, stakeholders, everybody to improve in terms of their skills around this topic, so that collectively we can move forward on the issue. And lastly, Lana, did you want me to share about your website, the Shift to Learn?
Yeah, great.
Let's see if we can get there. So Shift to Learn is what Lana shared with us. So they have a whole bunch of modules available for folks to access. Right now, their feature module is around engaging men and boys. And there are a number of them that you could access through their website. So please check it out. Anytime, if I can show you how my account would look like. Let's see.
And if people are interested, there's a discount code for Saskatchewan at 50%. So the modules become quite cheap. And as I think, take the SASS module. And if you get excited about the learning, that's the 101. And then hop on over to Shift to Learn if there's more interest. If finance is ever an issue, you can just email me. We do not want it to be a barrier. This is a social enterprise that's driven by Shift, university supported. And so we will always make it affordable for anyone who wants to take these modules. These came out of working on a 3-year initiative with 350 gender-based violence organizations that said we need a 101 to ground ourselves in primary prevention. And I'm super excited about the opportunity to work specifically with Saskatchewan, because I think you have unique social conditions.
Yeah.
And I think it's really, really important. All of you who are interested in advancing prevention, get the knowledge, the shared vision, work together with patients, Carrie, SASS, and all the member organizations who are trying to shift into moving into prevention.
Thank you so much. And I think a last thing too that I could ask is, after this webinar, if there's anything that you want to share back with us about your community, your clients, or what you're seeing, the conditions on the ground for you that you think this is probably contributing to the issue, please let us know, right? Because we are collecting all of that information, and we would love to come visit you as well. We're going to be doing a provincial tour later on this year. And so we don't only visit our members, but we visit partners. We visit anyone who is interested in working with this issue to talk about what are all the different conditions, right? And then we take all of that information back and we go after our policymakers, our leaders, across the board and say to them, this is what community is saying. So we want to be able to represent your needs accurately. We want to be able to present the story of Saskatchewan accurately. And so your contribution absolutely makes a difference. Thank you so much. Okay. I will pass it to Tal. Awesome.
There's actually just one more question in the chat if you have time. It's from Juniper, and it's how do we get buy-in for investment in true prevention when policymakers are required to get the best outcomes for the least expenditure? These are diametrically opposed systems from the outset.
A great question, Juniper. Part of our strategy has been working closely with key bureaucrats to build their skills and knowledge around this issue, and investment. And I think you do need internal champions with whatever funder you're working with. If it's at a government level, philanthropic, it is about building the relationship, giving them good data, reporting on impact, demonstrating high accountability and response, so it is those things that in my experience, and I'd like to hear from patients, and I hear you, it is really, really tough because, and I'm in Alberta with a totally different government right now as well. We are trying to figure out how to frame the issue in a certain ideology to make sense. And that takes skills and time, but it also takes building relationships and understanding the ministers and people in power and how they understand the issue. And then that puts the onus on us on how to frame it. And really, framing has become a big part of my work in the last 5 years of learning how to better understand the group I'm working with and how to frame so it's a win-win and it makes sense for those who are making decisions.
And another thing I think that would be helpful for us at SASS level is if you have leadership in your community that's sympathetic to the issue, right? And maybe it's just, they just need a bit of, it's the framing, it's education that they need. Let us know, send them to us. It could be leadership even from the local level, like your city councilors, right? All the way to your MLAs, because everybody matters. We don't know, they might not be a minister, but if they believe and they can be a champion to the issue, it just might be a matter of just giving them the right information, the key messages, and they can take it from there on. So, let us know who those people are, who are the champions in your community, and we can leverage them as well.
Well, thank you, everybody. I just,
Thank you so much.
yeah, thanks for everyone coming. I know how important everyone's time is and that you took an hour out to learn more about primary prevention. I want to honor Carrie and Tal and Patience and SASS. They're doing extraordinary work. They work so hard to try to advance prevention with the government of Saskatchewan. And so just want to thank them for their leadership as well. And thanks for inviting me here today.
Yeah, thank you, Lana, and thank you for your dedication to stopping violence on the upstream and for all the years of collaboration that you've put in to support us in bringing the primary prevention module to Saskatchewan. That concludes our webinar, but I would like to say thank you to our sponsors for this webinar, who are SIGA, Service Hospitality, Sleek Signs, the Saskatchewan Union of Nurses, and SGI Canada. They're our Sexual Violence Prevention Month sponsors. Also, our program funder for this module is the Public Health Agency of Canada and the Department of Women and Gender Equality of Canada. So thank you so much. We appreciate you spending a noon hour with us, and have a great week.
Thanks.
Thank you. Take care.